Hi everyone, this is Dorian. I'm hosting MedTech Trends. Today we have with us Saud Juman. And to introduce Saud, Saud has served as a mentor and a trusted coach to healthcare executives, hospital and compliance professionals, entrepreneurs, athletes, and young people. And he's been spreading his philosophy on the importance of being happy and healthy in life and in one's career. In 2001, Saud founded Policy Medical, which is a healthcare and policy management software company. Over the following decade and a half, Saud grew the company to a leading global brand serving thousands of hospitals and healthcare systems worldwide, making millions of patients and healthcare workers happy and healthy every day. And in 2018, Policy Medical underwent an acquisition, and he transitioned out of the company. Today, Saud is a sought-after coach in the tech world, both to founders and to company CEOs. He currently lives in Ontario and is the father of 4 wonderful children. And among his many interests include athletics, martial arts especially, and I'd like to ask you a little bit about that because I'm sure there were a lot of great learning lessons from that. But he's also big on meditation, spirituality, and basketball, reading, and writing. And writing is another topic that I've heard you mention before, that you like to write to yourself a lot. And I think that is a really good way to actually get your thoughts on paper, get yourself cleared up before you figure out exactly what you want to do next. So welcome, Saud.
Thank you. Thank you very much. Thanks for having me.
Now, you've been very active over the last decade and a half. After exiting your company, though, you're also getting into podcasting again, making appearances such as this one and quite a few others. What does it feel like right now? Just a big picture questions. Do you feel a sense of relief? Is there gratitude, excitement for your next project? How would you summarize that?
I would say I feel optimistic. I've had approximately 1 year off of resting, healing from the last entrepreneurial journey, and not really having the pressure to do anything immediately. So that's allowed me to sort of realize that I need to be more of in a state of being as opposed to doing. And it's something that another entrepreneur that actually has gone through this journey many, many more times than I have, he advised me to take the year off, along with my wife. She also advised me to take the year off. And the entrepreneur that suggested it, he actually said that he always observes that 6 to 12 months off between sort of major ventures. And he said it leads you to go from a human doing to a human being. So I can actually say that I'm starting to feel that a little bit. But in terms of future projects, I'm now at a point where I'm starting to feel excited. I'm starting to tinker, experiment, get a feel for what might be possible, and where I might be a fit to add some value out there.
Mm-hmm. Okay, that's such I feel like that's a really important thing. I think we have a crazy work culture, right? Especially in the entrepreneur world, people say, if you can work, 12, 15 hours a day. And then if you're doing that and you're building a company from scratch and you're doing that for months, years on end, I mean, that takes a toll, right? Even if your company ends up being successful, that really takes a toll on you. So just taking that time off. And I remember even listening to a couple of interviews, people say like Mark Cuban, I think he's one of the guys that'll say, he takes some time off. Bill Gates, I think I've heard a number of people that just say, every once in a while, I need to take a month off and just decompress a little bit. So have you felt the same way over the last year or so?
Yeah, I mean, I wish that I had that wisdom of those other people that you mentioned to actually do that along the way. I don't think I did that along the way. I thought I kind of had it all figured out in terms of my scheduling and calendaring while I was running my company, but in retrospect, I didn't. But I do think those bouts of rest, if I were to do it all over again, are probably critical. Actually, a couple of things that I did in the year off was I did a few sort of alternative medical testing, things that I've never really done before, just to see. So one that I actually did was a genomics test by a really, really interesting company right here in Canada, actually. Did the genomics test with them to actually get a sense of what my genes are saying. And then I went to see, along with my family, a naturopath for the first time. I've never really gone to see a naturopath before, but I did, what was it called? It was a dried urine test. Sounds a bit gross, right? But it's called a Dutch test. So the genomics test and the Dutch test ended up giving me this data on these graphs that sort of prove to me the damage of those incessant long entrepreneurial hours have done. Because if I were to just kind of assess myself just in my own brain, you know, and maybe with my own ego, I'd say, oh no, I'm good. I'm good. You know, I can, knock on wood, I'm relatively healthy. I can go play with my kids. I can still, you know, get around and play a few sports. You know, I should go for a jog. Those types of things. I think I'm good. But when I did the Dutch test and the genomics test, it actually showed me that the way the naturopath put it to me, she said that in my mind and my brain is firing in all cylinders, but my body feels like a caveman that is in danger of not having a meal for the family tonight, right? So it's still under a lot of stress and pressure, right? And that actually comes from so many years and years of not sleeping properly, maybe carrying too much stress, not maybe doing the things that would lead to sort of that work-life balance alignment, those types of things.
Mm-hmm.
So all in all, in retrospect, you know, I saw there in a few graphs that it actually has a literal toll, right? And the data is staring at me that, hey, here's the damage that you've been doing to yourself.
That's really interesting. We actually had a chance to talk to a naturopath a couple episodes back. But it's interesting you mentioned that. So rather than going to your family doctor, did you actually find it more useful to go to a naturopathic doctor to do that kind of testing? Was it easier the recommendation that way?
Well, I mean, I did go to a family doctor, right? I mean, family doctor, it's really, you know, based on my opinion, it's assessing something that's really acute right now, you know, such as, you know, I have a cold, what should I do, right? Or earlier on in the year, I was kind of hobbling around because I got what is called plantar fasciitis for the first time,
right?
Because I do a lot of martial arts in my bare feet and stuff. So I went to my family doctor. She sent me to a chiropractor. Chiropractor patched it up. Like that was all relatively at a surface level,
Mm-hmm.
but I was curious to find out what's going on at an adrenal level, at a genomics level, with myself, right? How could I not really biohack, but how can I maybe start optimizing my health and healing from such a long entrepreneurial journey?
Mm-hmm. That's really fascinating. I'd love to have a whole side conversation on that, but we'll save that for another time.
Okay.
So I definitely want to get into Policy Medical, what it is, what it does as a company. And I know you've exited that company, but it's your baby still, and you probably know about it still way more than anybody else. But first I wanted to get into, you know, how did you get into this, the entrepreneurial kind of journey, specifically at a point where you started Policy Medical, what it's been like developing it over the last 17 years, and also putting that into the context of the healthcare system. You've talked about this quite a bit before. I'm sure clients, colleagues in the industry, the healthcare system itself has evolved a lot. And I wonder how that evolution has also changed how Policy Medical underwent its own evolution to meet client needs over that same period. So I guess we can start there actually. So if we go all the way back to what was the initial idea that sparked Policy Medical? You know, how did you decide of all the things that you could do to impact people's lives in the healthcare sector, really, why, you know, a system that is designed to help organizations with issues like compliance, policy development, risk evaluation, and that type of thing? Why that idea?
Yeah, great question. So as I start my answer to that question, I think it should be duly noted, just so, you know, anyone listening to this podcast that has acquired Policy Medical, I am no longer officially involved in Policy Medical. I kind of observe it as a fan of the company from afar. That was my goal in looking for the right acquirer. I wanted to sell it and give it to another organization that would have similar values, that could take the thing that we had started and continue to have it blossom and grow within their ecosystem. So my role with Policy Medical now is simply as a fan and as an outside observer. But going back to directly answer your question, how did it come about? I think if we backtrack just one little era before the founding of Policy Medical, I was at a point in my 20s where I didn't want to simply just have a job and just go to work every day in a meaningless way. I wanted it to be meaningful. So having said that, I was really in search of trying to find out what I could do to impact, have some kind of positive impact in the world. And I just kind of knew that we're all meant to have some kind of major impact, right? And perhaps we can have multiple impacts through our life, but in my belief, it's like one at a time. So I didn't know it would be healthcare. So around that time in my 20s, I ended up taking some time to myself. In other talks that I've given before, I call it sort of my time of solitude. And it lasted a few months, quite a few months of me sort of searching and asking myself, what is it that I'm supposed to do? Give me some signs. What is that? What could that be? And then the idea started coming to me of impacting people's health and also happiness, right? Their health and happiness. But health was an overriding factor, just at a base intuitive level. So I kind of hung on to that and I said, okay, I'm going to keep my eyes open for anything healthcare related. Now, in retrospect, that could have been me being a personal trainer, that could have been me, like it could be like anything health or wellness at that particular time, right? But I'm a big believer of thoughts, and if you put the right pure thoughts out there, that intention out there, then you'll attract back to you maybe the resources and the people and the things that you need to make that thing happen. It's chronicled very well. These are not my ideas. It's chronicled very well in Napoleon Hill's book, Think and Grow Rich, right? Which is a great, great book that I reread each year. So once I had that idea of health, then a series of serendipitous events started happening. The first was I ended up getting a job as a recruiter in Toronto, right? So I ended up taking that job as a recruiter because I had lost my job in Ottawa. I was working for a company called Alcatel Microelectronics. That was around when tech was really booming in the Canada, Ottawa area. But then right around that time, the bubble had burst in a way for not just .coms, but also for telecom. So there were mass layoffs in that region. So I had lost my job, came back to Toronto, and then I got hired as a recruiter within the tech world. So I thought, okay, let me try my hand at being a recruiter. And I believe, if my memory serves me correctly, right around that time, 9/11 happened. So then the company I was recruiting for, they were primarily focused on the US market. So their business was really affected right away because of what was happening in the United States, unfortunately. So a lot of us got laid off from there. So then a buddy of mine who was also a recruiter, he called me and said, hey, there's this healthcare tech startup place in Mississauga, Ontario. You're interested in doing sales there? I said, sure, right? Then I said, absolutely, because I remember the whole thing about health, right? Health startup. Okay, maybe this is something. So I went to that company, and I only worked there for a few months because within maybe 6 months, something started to happen. I started trying to sell their solution. And whenever I would try to sell their solution, the potential customers would tell me, is this what you guys are doing? And I think at that time, again, if my memory serves me correctly, what they were building were hospital-focused intranets. So a little website that would be in the hospital to post cafeteria menus, and is it child safety day in the parking lot to teach new parents how to install car seats, just things like that to do with the hospital.
Kind of like announcements, like an announcement kind of platform.
Yeah, exactly. It was pretty simple, but the hospitals were saying, this is good, but do you have something that does this? And I would say, no, we don't do that. But enough potential customers in the pipeline started asking me that one singular thing. And then whenever we would sell their product, the company I was working for, the engineering team would come to me and say, oh man, this is pretty stressful. I'm like, what's stressful? The new customers are saying they don't want to use this product as an intranet. They really want to use it to do this. And I said, oh, that's interesting, because on the sales end, they were asking for this. Now on the implementation end, they're asking for the same thing. there might be something here. So I didn't know what to do. I took that idea to the CEO and the VP of the company. It was a small startup. And I said, hey, I'm just a guy in my 20s, right? And again, the ecosystem of the city that I live in right now, which is Toronto, was not what it is now, right? Now it's a very booming, vibrant tech ecosystem with so many incubators and resources and investors and angels and everything else. Actually, it said my internet is unstable. Is our connection still okay?
We're still good. Yeah, we're still
okay.
good.
All right. So I went to them and I said, I'd love to explore this idea. Actually, I think we should stop building this product and pivot to make this other product. They weren't interested. They said, just go back to your cubicle, just sell. So that didn't sit well with me. And literally the next day I decided I'm going to resign. But there's a couple of problems with that. I'm not a developer. I don't know how to program or code or anything like that. So I took the head developer for the company across the street to the food court at the local mall, and we sat down and I said, hey, we should quit. He said, why should we quit? I said, well, here's this idea. The customers are asking for this policy management system and they don't want to build it, right? So there's no conflict there. It's different from what they're doing. Let's leave together and build it. He said, well, what do we build? I said, well, let's start writing it out on a piece of paper, what the customers want. I'll gather that, you build it, and I sell it. He said, well, where are we gonna work? I said, I know this office space, right? It's 24/7 access. It's got a gym. It's got catering. It's got, it's already got phone lines, everything else. He's like, where is this place, right? Remember, this is like, in early 2000s, right? There weren't all these co-working spaces. I said, it's in Scarborough. It's my mom's house, right? It's her basement, right? I said, she'll cook for us. And my old weight bench is there. And there's a couple of desks. Let's do it. So the very next day
and you actually convinced this person to drop their job and go work with the startup.
Yeah. And I wrote his resignation letter for him. He said, I don't know how to write a resignation letter. I'm like, I don't know. I wrote one. I'm like, just copy and paste your name on it and let's just quit tomorrow. So we quit and then we started the company, right? And there's so many other lessons. I don't know where you want to go with those in terms of how we got our first customer and how the first year looked and all that other stuff.
Well, I'm actually really curious about the kind of stuff you were hearing from hospitals and other people that you were trying to sell to from the first company, and the stuff that you were actually hearing. Because if this is early 2000s and you're saying that hospitals and the other customers are coming back and saying we actually need a policy platform, I wonder how exactly did that come? Like, what were they thinking? What were they actually asking for at that time? Did they know that there was such thing as like you can build an actual software platform to track and manage and build your policies for those specific purposes?
Good question. So it was simple at first. So it was actually US based hospitals that were asking, not the Canadian hospitals as much. Okay. So that was the first thing that we had to learn in the first year, because we really didn't realize that until we started trying to sell this thing and thought we're on to nothing, because we thought we're in Toronto. Let's go to University Avenue in Toronto, and where all the hospitals are, and sell this to Canadian hospitals. And we failed at that because they didn't want to buy it. Mm-hmm. But we can get into later how we penetrated the US market. But
was that a budgeting thing on the Canadian side, or were they just not interested for some completely different reason?
It was budgeting, based on my understanding, right? They just didn't have the budget for it. It wasn't something earmarked with the funding, right? In the US, it's a much quicker sales cycle. Mm-hmm. It's privatized, and there was more pressure from the regulatory and compliance people for them to have something in place. But to answer your initial question, the needs for them initially were very simple. They had these policies in physical binders on shelves, right? That they would go and they would read. And what they were finding were nurses, doctors, surgeons were referencing and following the wrong policies that were 20 years old, 15 years old, 10 years old, et cetera, and doing the wrong things in patients, which would lead to lawsuits, claims, etc., because the United States is a very litigious environment. So what they simply wanted was a searchable database for the policies to be in, so clinicians can pull up the policies faster and with more accuracy. That was the base product, right? So remember, back then there was no Dropbox, there was no Box.net, there was nothing, right? So our first version 1.0, was simply a searchable database platform where they can upload the Microsoft Word versions of their policies. They can search for it, they can find it, and then the big game-changing feature in the first year that just blew them away was we would send them email notifications of when the policies were due, right? This was like this, and you know, I'm being sarcastic because now, like, we think like that's like, well, of course, it's so simple, right?
Now.
yeah, exactly. So that was the first version, and then it completely continued to evolve from there.
Mm-hmm, mm-hmm. Wow. Okay. So, I mean, I've actually worked in a few hospitals and in the research capacity in medical centers. I've gone through a few of these cycles of going through, SOPs and policies and having to find them and getting, it's actually surprising even to this day. There's still places that use, I don't know what the right word would be, but it's very tedious to go through some of these platforms. So I don't know exactly how Policy Medical compares to those, but it's still very much a problem even today. And there are thousands of hospitals across Canada, thousands of hospitals across the U.S. If there's a way to actually streamline the entire policy system within these hospitals, which are incredibly complex, it's solving a big problem, is what I'm trying to say.
And it's changed quite a bit. So I mean, that was almost 20 years ago, right? Now the hospitals are much more sophisticated, much more savvy. If anyone tries to sell them a simple searchable file sharing database, they would say, no, thank you. We have a corporate license to Dropbox or Box.net or Microsoft SharePoint, etc.
Mm-hmm.
Yeah.
Exactly. I was going to say, like, even as a competitor, potential competitor is just Microsoft SharePoint. Exactly. You just drop everything on there. It's got a search function. You just, enter your search keys and then something will pop up. But it's oftentimes it's not all that relevant or what have you. So I'm fascinated by this idea of really building something that's customized and specific to the healthcare sector. And I wonder, from your perspective, over this decade and a half as you were building and developing this company and these products, how did that evolve from your version 1.0 to version wherever it was, right before you exited the company? How did that evolve?
By listening to the customers. I think that was one of the most consistent things we naturally did at the beginning. And we did throughout most of the journey for Policy Medical. When we did lose our way was sort of midway through the lifeline of the company when I was there, was when we stopped listening to the customers and we started taking them for granted. And we lost our focus, and we were simply focused at that time, at that chunk of time where we lost our way. And if we kind of look at it that way, we were mainly focused on sales and acquiring new customers and not really listening to the customers that we already had to see what it is they needed, how their needs were evolving, etc. But once we got back to that, it just continued to evolve along the way. I think it's quite a simple way of doing things. I mean, these days, if I'm advising or mentoring or investing in companies, I don't always see that there's that simple mechanism in place to really listen to your customers. And when I say listen, like attentively listen, have systems in place, processes in place to always have the right types of touch points with your customers to gather the data that they need. And also to listening sometimes is to listen to what they may be asking, but to have the wisdom to know that you shouldn't give them that feature, right? What they actually need is something else, but you can only get that from really, really listening to them.
Mm-hmm. So you mentioned two things that I definitely want to come back to. Maybe we'll do them in order, but the second part is the advising and the mentoring. And I know you're starting a coaching or have been, and you're building a coaching and mentoring practice. And I know that's also something that you've talked a lot about in the past. So we'll get into that a little bit more. But on this topic of listening to your customers and figuring out what it is that they actually want versus need, and solving that problem for them. I wonder if you can take us through, like, what was your philosophy on that? What was your approach in getting that, and what systems did you put into place to do that?
Well, it's interesting that you say want versus need, because one of my mentors, my main mentor, he has systematically taught me over many years the personal philosophy of want versus need that him and his family business actually imbibe, right? And they've got, that's a story for another day, but quite an impressive family, right? It's a multi-billion-dollar empire. It's over a century old. It's a massive conglomerate, but they operate on a simple principle of want versus need, whereas they attain all of these resources. They retain just a small amount of what they need, but they give away charitably everything else. So in terms of the customers, taking it to a business perspective, that DNA was already inside of me, right? So we would, at first, to bring the company out of that slump that we were in, because when we started, we were going really, really well, right? And if you kind of see over here, like where the company ended up ending, it ended up going really, really well before the exit. But in between my hands here, we dipped and had to come back up. So in that dip, I had to do a gut check to make sure that I still wanted to do this. This was still something that was part of my calling of impacting people's health. When I answered that answer as yes, okay, I do want to still do this. Then it was a matter of, how do we get out of this mess, right? Because at that point we were almost flatlining, almost virtually bankrupt at that point. And then I ended up going on the road. Personally, I was out of balance at that time because I wasn't sleeping properly. I was drinking way too much coffee, all that other stuff. But on the business perspective, I took a moleskin notebook and I went and I visited every single client that we had, right? So at that time we had a couple hundred, right? It wasn't the thousands and thousands that we ended up with, right? But it was a couple hundred. So when I say visited, it wasn't phone calls, right? And this type of technology to do what we're doing now just really wasn't that accessible. So I would fly, sit with the CEO, the chief nursing officer, the chief medical officer, whoever the decision maker or makers were at each client, and ask them a couple simple questions. I would ask them, what do you think of us? And they would say, oh, you guys are good. But what they meant was, you're good enough. We're not going to cancel our contract, but can we hurry up this meeting a little bit because you're not really great. And yeah, and that was it, right? So then when I sensed that, I said, well, what do we need to be great, indispensable, right? What do we need to take you from being a customer to a fan? And they started giving me lots and lots of ideas, feature-wise and customer service-wise. And I would simply write that down in my notebook. Okay. And then bring that back to my company and start formulating the game plan of how to restart the company, recharge the company. Mm-hmm. Which ended up, in retrospect, it ended up happening in 3 distinct phases over a 5 to 6 year period.
Okay. Yeah, I wish we had all day to talk about this. I love getting your experiences, your perspective on actually solving those additional problems. I wonder if you think back over that exact period, actually, were there any particular client experiences or meetings with your clients that really stood out to you, that really sparked something that you knew that was going to change the company for the better, make it great, make it go from good to great?
I think it was again, some of the stuff I'm saying, it might seem so simple, right? But it's physically visiting your customers, mm-hmm. right? Especially your largest customers, right? That 80-20 rule, right? 80% of your revenue comes from 20% of your customers. These days, I think it's probably 90-10 or 95-5, right? In truth, for most industries. And towards the end, we had organized our customers based on platinum, gold, and silver, like different tiers. So those platinum customers, and the platinum customer doesn't necessarily mean dollar signs, the ones that are paying us the most. They were also included in that platinum mix of customers that we had, were loyal, long-time legacy customers that have been with us, right? So one experience, to answer your question, that really, I was like, I need to show up. I need to visit these people at least once a year to just sit with them. I need to walk the halls of the hospital get out of the boardroom of the hospitals with the people that cut the checks to pay us, spend time with the nurses and the lab techs, et cetera, to see how they're using our software. And I remember there was one lady. I hate using the word user, right? Because somebody told me a long time ago there are only two industries that call their customers users: technology companies and drug dealers, right? So this one lady, she would submit lots of help desk tickets to our company about how difficult it was, how lengthy it was to update policies within our software, because we had a whole workflow collaboration piece with Microsoft Word, and you can edit it and update the document, right? And I just wouldn't, when my customer service people would tell me, it's another ticket from this person, they're just complaining. And I would say, in my mind, I said, no, the features are fine. Like, it's fine, they're great. But when I showed up at that hospital, it's a large chain in San Antonio, Texas, and I finished the meeting, I said, oh, by the way, can I meet with so-and-so, right, in the lab? They said, oh, let's call down there and see if she's there. And she's like, yeah, I'm here. And so I went down there, and I ended up spending a half a day just sitting with her. And I said, can you just do your job, right? Just do what you do. And she goes, well, a part of my job is spending lots of time in your software. It turns out that she had tons of great ideas. It turns out that she also had a physical disability with one arm that made it very difficult to actually do some of the functions that our software required her to do. And by sitting with her, I realized that there were so many extra steps and extra clicks that were a complete waste of time that we could eliminate to make her life easier. And if we're making her life easier, we're making every other able-bodied person's life exponentially easier. And in that chat, she also shared with me, she said, I have a disability, Saud. She goes, but, do you know that you should be accounting for people that are dyslexic, right? That in terms of the refresh rate of your software, how about different font sizes, right? She was very tuned into people with disabilities. So I gathered like all this data that I never would have gathered if I didn't physically go and just spend some time with her.
Mm-hmm. That's a really powerful thing. How often do you reckon, somebody at a CEO or founder level would actually do that? Like in all your experience coaching, talking to other entrepreneurs, how often do you think that actually ends up happening?
Very, very, very rarely. So I think a lot of CEOs will say that, no, they break bread with their customers, but yes and no. Not when it's in a sales capacity, right? So when it's in a sales capacity and you're brought in as a CEO to wow the potential customer or the existing customer to get more business, that doesn't count, right? It counts where you're going there quietly to learn, right, and to be taught. Mm-hmm. So I don't think it's enough. And also, I was very surprised at the end when we're looking to establish partnerships with other potential companies and things like that, other software companies. I would meet with other fellow CEOs, and I would often say, I'm like, okay, can you just pull out your laptop and give me a demo of your products? And I said, I'll do the same. And to say, we'll have to arrange something. I've got to get a sales engineer, and it's these people to actually demo the software for them. And my thought was, why don't you know how to use your own products? Right?
Right.
How do you not know this? Like, how can you lead this company if you don't know your own products?
Right. No, we ended up having an earlier episode. I know I'm kind of digressing a little bit, but I was surprised when the CEO of that company literally did a live demo of the product, and I was kind of blown away because it's a big company, very successful company, successful CEO, but it really makes a big difference, especially to me if I'm looking at it from the outside in, and I'm seeing that like somebody at that level knows exactly how the product works, is actually involved in the development and in selling and understanding customers' real needs. It makes a big difference. So I completely understand and agree with that point. So I want to also get back a little bit into the point where you built this over a decade and a half, and then you made the decision that I've built this up to the point it's created a lot of value for a lot of customers. I think it's time that I transition out of this. Can you take me through what was your thought process on that? And also, what was the experience of exiting the company like?
So my thought process of deciding to leave,
Right.
um, it was overdue by at least 3 to 4 years. So I had wanted to leave probably 3 to 4 years before I actually left. And the reason is for many, many different reasons. So one of the overriding reasons that still pops up now is it wasn't fun anymore, right? I often joke that, and I don't know how I'll sound saying this, right? But if there was a hospital policy management software Olympics, right? I would probably be on the podium, right? Bronze, silver, and gold, right? And like if there was, I remember there's a restaurant out there. I'll give a story to illustrate my point with that. Right? So there's a restaurant I worked at when I was a teenager. It was one of my first official jobs. It's called Harvey's in Canada, right? So the whole thing with Harvey's is you go in, they give you a hamburger, it's not garnished, right? And you stand in front of the customer and you have the lettuce, tomato, everything else in front of you in sort of a semicircle, and you've got to garnish the burger
Right.
for the customer. So it's made
Kind of like
fresh.
Subway, basically. It's like the Subway of, or any one of those like sub places where they have to put the toppings on there with you, like you're standing in front there, right, instructing them.
Yes.
But for burgers.
Yeah. But I became so fast at garnishing people's burgers, right? that my manager said, he goes, there's I forget what it was called. It was like the Harvey's Olympics, the garnishing Olympics. He goes, you should enroll in that. He goes, the rate at which you're able to do it and wrap up the burger and everything else, right? It's phenomenal, right? So if I kind of, that makes me think of hospital policy management. Like I did it for so long that I thought to myself, okay, it's like garnishing a burger. I can sell this software. I know trajectory-wise where the product is going. I knew that little micro niche so much. I thought perhaps there's more for me to do out there to continue to impact people's health and their happiness. That's not this company. And also I realized, having that thought and that feeling, that I am probably not the best leader for the company anymore. It should have somebody with fresh energy, fresh perspective, right, to continue to have this thing grow. It's not fair for me to stifle the company because I'm not having fun anymore. So that was the personal reason. On the business end, technologically, I see the market is changing. And the way that the product was going and the competitive landscape where it was going with the other competing products in the market, I saw it getting increasingly commoditized, right? More and more and more. And there was very little differentiation between the products out there, right? I saw the way to differentiate it further, and I'm still yet to see it. I don't think any of the companies in that space have done it yet. Mm-hmm. But because I did it for so long, I wasn't really interested in being the person to help lead the charge to change things even further there. Mm-hmm. So that's when I decided to leave. And I decided, it's going to be through one of two ways. One would be an acquisition where I'd be out in a clean way. The other, if that didn't work and nobody wanted to buy the company for some reason, then I was still planning to leave and hire another CEO, right? And I'd continue to be the chairman or the board or whatever it is, right, to help guide the CEO in the background. But I would be much less involved with the company.
Mm-hmm. Okay. And so the company ended up going through an acquisition.
Yes.
I wonder if you can talk a little bit about that, like some of the players that were involved, or I don't know if that's confidential, if you can't get into it.
Yeah, the actual names, I probably shouldn't get into it because I signed so many documents prohibiting me to do so many things that I should probably be safe for, and not say names and things at least for 3 years. Mm-hmm. But the process you asked about, how the process really, really sucks, right? It's not fun. It's grueling. Mm-hmm. It is. It's not. I don't know if anybody would find being acquired, the actual process, the 6 to 9 months of the acquisition, fun, right? Because it's not. We were in a good position because of some of the advisors we had involved in the company. and we were completely bootstrapped, right? But we had people that were working in the company as employees that had gone through acquisitions before. So they were able to share in their previous journeys some of the things that worked and didn't work. So we were very prepared, right? We had something called a data room prepared, where we had all of our contracts and our customer data and everything else nicely organized. We had our financials nicely organized. So we had everything clean, ready to go. But even with that, the amount of due diligence that is required and the amount of needless questions, right? So the whole process is very, very, very grueling. And then on the flip side, there are not many white papers or books or case studies that talk about, when you're the leader of a small to mid-sized company, right? And really, like, you and maybe one or two other people have the line of sight into everything going on. It also, there's a lot of like intangible politics and human uncertainty that bubbles up that you can't really account for, you can't really help with, right? Because everything's changing so fast, right? So you almost start becoming like a therapist for the employees that are working there, because they start getting some uncertainty as to what's going to happen, right? Am I going to lose my job? Am I still going to have a job, et cetera, right? So, in retrospect, could I have handled some of that stuff better? Yes, but only retrospectively, right? Because the truth is, if somebody asks me a question like, do you think I'm going to lose my job? And I say no, right? But then they end up losing their job anyways. Did I lie? No, right? This is all the learnings. When I said no, it was because I genuinely believed no. But then as the deal evolved and it was starting to get finalized, that no became a yes, right? So things change so fast and pivot so quickly towards the end.
Mm-hmm. Yeah, I mean, I can imagine, just given how long of a process that is, that a lot of things can happen in 6 to 9 months or longer if it takes that much time, and it's really hard to say exactly where it's going to go. But yeah, it's an interesting point. I mean, I don't know how many people I should think about what that process is going to be like. I think maybe healthcare startups might be a little bit different than general tech startups, where people say, you know what, I'm just going to move in, do something new and interesting, and then exit. I think in healthcare, and you might have mentioned this before, it's more of a longer process. It takes time especially for a healthcare tech company, to get up and running, to become useful, to grow. We're looking at, relatively long-term kind of plans if you're looking to start a company like this. And then a lot of people don't really end up thinking about what it's going to look like if you decide to exit or to move on to another opportunity at the end. So I'm sure it's just a long and complex process for sure.
Yeah, I think people should plan as if they're going to sell their company from day one, but also run it as if they're going to have it for 30 years. And why I say that is, if they're planning as if they're going to exit very soon, they will start adopting the correct corporate governance tools and processes and ways of running a company, because then you're running it in a way almost assuming that third party is going to come in and look at all your stuff, right? And if you run it in that way, then it's going to be much more organized all the way along. But then if you run it as if you're going to have it for 30 years, which is a long time, then you're also building this meaningful culture along the way.
Mm-hmm. Okay. Very, very great point. I'm sure a lot of people could benefit from hearing that sort of thing. I wanted to talk a bit more about one of the trends that really helped to push the company through into, its growing phases. And then one of the ideas that I had was this trend toward patient empowerment. But not just patient empowerment. I think it goes a little bit beyond that. It's really about customer stakeholder empowerment, because in the current landscape in healthcare, it's really a combination of patient empowerment, but also provider empowerment, and making sure that everybody has the information that they need to make the decisions that they need, and then personalizing those things. Did those pieces of context, did they play into the evolution of Policy Medical?
Absolutely. So, I mean, we can talk about the patient side and then on the vendor side, right? So on the vendor side, I always felt that there's not enough fluid, porous communication between all of the vendors. it's still very siloed because everybody is protecting, quite frankly, their pot of money, right? Their users, their license fees, etc. Everybody talks a great game that, oh, no, we would love to integrate, right? So if you look at something like an EMR, right, from Epic or Cerner, for example, right? One of the things that we were discussing at Policy Medical in the final years that I was there was, okay, how do we just open up the hood here, right? Let's just try to be as open as possible and try to integrate as much as possible with as many different applications as possible, right? Because like one micro example I can give you is if I'm a nurse and I am outside of a patient's room and I have to pull up their medical record, right? I can do that in the patient's room or on the kiosk outside or whatever, right? Chances are I'm going to be in their medical record more than in the policy management system. So if I'm on a screen looking at their electronic medical record and then I realize that, I got to reference this procedure. Now I've got to walk down the hall, go to a laptop, right? Get into our seamless cloud-based system in AWS and access it there, right? Which is okay, but it would be much more powerful if right from the EMR, as an example, right, for John Smith, it actually had a link to the relevant procedures for him, and you can view it right within the EMR, right? So that's just one of maybe 100 examples I can give you, right? Where vendors should be talking to each other, but it's just not there yet, right? And I don't even think that it's not there technologically yet. I think it's not there in terms of from a business perspective, right? I almost feel like the stakeholders, the hospitals themselves, the customers, they need to almost start mandating that, okay, no, here's what's needed, right? Here's what's needed. We're not buying XYZ system unless you can integrate with this and this and this. And then, yes, they're going to have to choose their premier technologies, right? So, it could be Epic if it's their EMR, it could be MedTech if it's something else. Like, who knows what it is that they choose, right? But those are like they're non-negotiables that all the other vendors, small and medium, have to integrate with now, have to talk with. So that's on the vendor side of things.
Okay.
Yeah, on the patient side, if you want me to comment on that,
sure.
I do think that patients need to be empowered more to have not necessarily more information, because there's loads of information out there on the internet, right? So I think there's lots of Googling happening and patients walking into specialists and their doctors with information, whether it's true or false or whatnot. So that should continue to happen. And I think clinicians should frankly get over it and not give patients a hard time if they're doing that, right? But the other thing that I think should happen is doctors and clinicians should share more with their patients, right? So a wonderful friend of mine, he's the chief of surgery in Oakville. He wrote a wonderful article in the Toronto Star recently that actually called out some of this stuff, right? So he encouraged patients that when they go and see a specialist, they should say to the specialist, oh, by the way, the consult notes, the notes that you just took in this visit, I'd like a copy of that, right? Regularly ask their family physician, oh, by the way, I'd like a copy of my medical record. And then for the patients to read the consult notes and the medical records and underline things that they need clarification on, underline terms they don't understand, probe further, right? If a patient is being told that they need to go for surgery or they need to go for a certain procedure, challenge that. Ask why. Why do I need that? What's the rationale behind that?
Where do you think that lands a patient, though, nowadays? I mean, if anything, I just see that there's potential for a little bit of confusion. It's very hard to understand medical terminology oftentimes. And then the other part of it is, what do you do with that information once you actually have it? And does it cause tension for you to actually get that information from a clinician?
It probably would cause tension. It might cause tension. But then if they're given an explanation, then you got to keep on asking for further clarification until you get to a point where you understand what's being done to your body, right? Because it's your health at the end of the day, right? I think that's what patient empowerment is. It's not simply somebody saying, don't worry, I've got all this training. I
Right.
know what I'm doing. Just trust me. Trust me. I need to cut this part of you open and take that out. Trust me. Right. Because like in every other part of our life, like we wouldn't do that. Right. We wouldn't just go to a professional and spend a bunch of resources and with them simply saying, trust me.
Hmm.
And in essence, that's what's being done from a patient perspective in healthcare. Just trust me.
Right. That's a fascinating point. I love that whole topic, and there's definitely more and more discussion about that in pretty much every source of media you can imagine nowadays. And rightly so, I think. In a lot of ways, it's just you want to be able to empower yourself to understand what your own medical state is. The best way to do that is to understand your medical history. You need information from clinicians, and it's not something that we're traditionally used to asking for or really to using or acting on in a customized way. So I think there's a big shift there across the entire industry, really. So Saud, I wanted to also get into now, what are some of your next steps? Obviously, you've had a long, really successful career in healthcare. Do you see yourself staying in healthcare? I know you're starting a coaching practice. Where do you see that going?
Yeah. So I operate in intuition quite a bit. So intuitively, I feel if I were to start another company right now, it would be a very egoic thing to do. I feel like I need more time to heal and rest and not start my own venture right away. So I'm probably 18 to 24 months out from seriously sitting and thinking, do I want to do another venture on my own? So that I've kind of parked, and it's just kind of simmering there. Um, uh, but in the meantime, I've started a coaching practice, right? Really, that came about organically. Post exit, I got a lot of outreach of people. Even before the exit, several years before, I was coaching quite a few people, but I just didn't have as much time as I do now. So now I'm coaching. I'm doing some public speaking, and I've started to write a little bit. Toy with writing and submitting some articles, or toying around with writing a book or two. So that's more of sort of a long tail sort of strategy for myself. But the coaching practice is really picking up, and it's a lot of fun because I get to pick and choose who I coach, right? Which is great. And I get to, I even determine like the type of values really that I'm looking for in somebody that approaches me to coach them. I want to stay within healthcare. Majority of the people that I do coach are healthcare CEOs or healthcare entrepreneurs.
Hmm.
And also there's a healthy mix of SaaS based CEOs and entrepreneurs as well, that are non-healthcare as well, because the dynamics are the same, right? A business is a business, right? You mentioned before that, within healthcare, it might take a little longer. I don't believe that. I think that within any business, it takes a little longer than people think, right? I often tell people that if you're thinking of starting a business, you better be prepared mentally to be in it for 5 to 10 years, right? Because that's the norm out there. But yeah, growing the coaching practice is something that I'm really excited about. I don't really exist anywhere online other than LinkedIn. So I've even I've started to set up a website and things like that for the coaching practice. But right now it's really word of mouth, and I kind of enjoy being that way. Because I'm looking for 3 or 4 specific values in the people that are asking me for mentorship and coaching. And if I don't see those values, then I just would deem it not a good fit.
Hmm. Do you think there's something unique about people that want to start healthcare companies as opposed to other like tech companies or whatever other kind of companies? There's something unique about a person that wants to stay committed to a healthcare startup.
Yeah, I do see something in the healthcare space, the health tech space, that's different from other spaces. Um, uh, and then I see something that's common, right? So the one unique thing that I see is people that want to start something, they've got a real heart of gold, right? They really want to be of service to people. They want to help people, right? That's why they're trying to fuse together their passion for healthcare, but with leveraging technology. So those people, I really like, and I do think they need to surround themselves with the right, honest business type of help to help them get going. And then there's the other faction of the health tech sector that I'm seeing, because healthcare and technology and the intersection of those two, it's very popular. So you're finding people that are simply like, they simply want to be a founder, right? This is something that I found in the tech space in general, right? When I'm meeting new potential companies and new potential founders, their real drive is to be known as a founder, right? And maybe ride the health tech wave. So that I really, really disagree with.
Mm-hmm. That's an interesting point. Very different perspectives, I think. You can't, I think, adopt the same approach of the move fast and break things type of mentality in healthcare as you would in a tech environment. So I would imagine that it requires a different mindset, a different way of approaching business and solving problems that exist within the sector that need to be solved. Um, if you could summarize your personal philosophy on coaching and mentoring others, what would that, how would you describe that?
I usually go through a few different phases, right? So people come to me, I've noticed, for coaching because they feel, right or wrong, that I've quote unquote done it, right? I've taken an idea, we've bootstrapped it, we've built it, we've penetrated really, really well, and it culminated, at least at where I got off in the journey, with a great exit. So that's what they come to me for initially. But again, when they're asking me for coaching, I'm literally looking for 3 or 4 specific character values in that person, right? Because I know that the coaching is going to go from business, right? So the business stuff is relatively simple, right? They may need to increase their sales or bolster their marketing or turn their customers into fans or put in the right financial systems or those types of things. Those types of things I can guide them, coach them on how to make better. And that, I'm not saying it's simplistic, right? But it's not rocket science, right? But then we start moving into the personal side of the person, right? Which is reconnecting them to, why did you get into this thing in the first place, right? That whole Simon Sinek why, like, what's the why? Like, what called you to that, right? And then I start asking some harsh questions as to why they're doing it to uncover that. And then it's reconnecting the person with the business again, right? The actual core values. So that's really my philosophy. It's very holistic because, you know, I've got so many mentors in my life, but one of them said, you know, we should always sort of observe a tripartite division of time in our days. So 8 hours of sleep and rest, 8 hours of spending time with family, friends, recreational, personal interests, etc., and then 8 hours a day of meaningful work, right? So the work piece, it's got to count for something more than just making money or being known as a founder or having a press release written about you or whatever it is, right? It's got to have an alignment with those other areas of your life as well. So part of my coaching is building those bridges back to the other parts of that person's life.
Mm-hmm. I find, especially in healthcare, and again, you know, working in this industry myself, it's I think there are a lot of people that want to do good work, and I think on the flip side, there are often structures and frameworks and histories in place that make it difficult to really see that the meaning behind the work. So some of that work ends up getting lost, and I think to some extent, working in a smaller company, a startup, or small medium-sized company, maybe you're you know, proximity wise, you're a little bit closer to what the impact of the work actually is. It's just that I wonder if you can comment a little bit about like the work structure, working in a big company early on in your career versus working in a smaller company. How is that different to you?
I mean, I've got my own personal lens on it, right? I mean, even post-exit, I've been exploring what it might be like to have some kind of entrepreneurial role within larger companies as well. But I feel, for me personally, I feel that a smaller company, the impact is greater. You can feel the impact of your work. Whereas in a larger company, based on my personal experience, I know it's different out there. People will have different lenses. And the caveat is I haven't worked in a big company for a long, long time. But I feel like at a bigger company, you're so far removed from the impact that you could actually have that it almost feels like that proverbial pushing paper. You're just like moving paper from here to here to here to here. But what's the actual impact, right? So the thing that I measured along the way with Policy Medical was how many people each day would be impacted by our software. So that's employees at hospitals, that's patients, and that's members of the different communities, right? So communities meaning Ottumwa, Iowa, Johnson City, Tennessee, right? Manhattan, New York, like wherever, Huntington Beach, California, like wherever the hospital would have been for us, right? What's the impact, right? And I used to count those numbers, right? And
can you put a number on it, like off the top of your head, if you remember?
It was in the millions. It was in the millions of people each day that would be impacted, like the ripple effect of it, right?
Mm-hmm.
Now, the actual people touched by the software, it's in the hundreds of thousands at any given time, right? The employees going in, right, referencing this, to connect it to this patient, et cetera, right? Which is like a really gratifying feeling that, okay, this software is actually having a direct, meaningful impact in terms of improving people's health and their happiness. Right, that's the line that I could draw. At a larger company, I feel like you could start drawing that line, but it's like, where does it connect to? Like, I can't see where it goes.
Mm-hmm, mm-hmm. And on that point of that again, personal philosophy of incorporating health and happiness into people's lives and in the work they're doing and in their personal lives as well. I want to come to a close on a couple of the things that I think have been very important to you as you've grown in the last couple of years as you exited the company. Obviously, you have a lot more time now to spend with your family. I'm sure that's a really big and important thing. Although I've heard you mention before that you did try to separate those two out to be able to spend that time because I know your family has grown over the course of building Policy Medical. And I wonder if you can comment on that a little bit because I think it's important for a lot of people. How do you find that balance and how did it work for you to actually build a company but also have a growing family? And then we'll wrap up on one of the topics that I found you were really interested in talking about is medical qigong and meditation and what that means for people in your life and in other people's lives and how you want to spread that.
Okay. So work-life balance and balancing a growing family with building a company and a startup. Like, how did I manage it?
Right.
While I had the company, I thought I was managing it very, very well. In retrospect, I realized that I managed it very poorly, right? So I wasn't seeing reality for what it was. So while I had the company, if I looked at my calendar, let's look at the last 2 years of when I was the CEO of the company, I would work for 6.5 to 7 hours a day. That was my block of time. And outside of that, I wasn't working. So I thought that, okay, I was there for my family. I've got this all pretty balanced. But running a fast-paced startup, and anyone that's watching this that's doing it, they know what I'm talking about, right? And then also pursuing an exit from said startup, right? When you start pursuing an exit, that's all of a sudden a second entire full-time job you just took on, right? That is so consuming that in retrospect, I feel like I should have done and I could have done much better towards my family, my children and my wife. So yeah, I mean, that's what it is. Like, you tried, but I can say retrospectively that I could have done better. And now tactically, like, what are some of the things that if I were to do it all over again, like what would I do? Right. And some people sitting there might say, well, okay, well, you exited. So if you do something again, it's maybe the pressure's not the same, right? The hunger is not the same. Maybe so, right? But I can only comment from where I am right now. So if I were to do it again, I would say that once you come home from the office, right? And these days, like, the office could be like, okay, you log off of Zoom, or let's say you work remotely. A lot of CEOs do that, right? So once you draw that line that, okay, I'm done working, put your phone away, right? Put anything that connects you to the business away, and then truly try to be present with the children. Like, that's if you have kids, right? I think that's something that I should have done better, right? I thought the fact that I was physically around in the house with them, now I'm not at my office, right? Because I had a separate office. I'm good, like, I'm doing this, right? But fully listening to them, being involved with them, those types of things, like slowing things down, like I should have done a better job with that. that's what I'm trying to do now. In terms of my wife, she told me so many things in the past, so many pearls of wisdom and bits of advice that I didn't really listen to, right? But until some consultant I paid a bunch of money to, or some professional or some lawyer or accountant told me the same thing. And then I'd say, yeah, you know what? Here's what we should be doing, right? So I think really along the way, giving her credit for being a fully equal partner in everything good that's happened with the business is something I should have done all the way along the way, and not retrospectively. Because anyone that has a spouse or a partner that's trying to do a startup, but that spouse or partner is not officially part of your business, doesn't matter, because that person is at minimum 50% of the reason you're succeeding, even if they're not in the boardroom.
Yeah, that's an interesting comment. Just based on some of the recent stuff that happened with like Jeff Bezos and I'm sure some other people out there in that whole entrepreneurial world. But it hits home. Makes a lot of sense. I mean, this is someone who is with you all the time. So really important to respect and to understand that how much of an impact that actually has on your success, really personally, and in keeping you together, and I think well balanced. And on that point too, so you'd mentioned your growing interest in both meditation and medical qigong. I wonder if you could talk a little bit about that. What is that like? Is that something you personally practice right now? And by the way, actually, are you still involved in martial arts? Do you still train or do any of that kind of kickboxing? I think it was.
Yeah, so I do things for a long time. So when I start something, it pretty much usually sticks around for the rest of my life. So martial arts I've been doing since I was a child. I still train. I used to teach for some time, but these days I don't feel like teaching martial arts. So I'm part of a great dojo where I live in Oakville, and I train as a student, right? So it's good, right? Gives me some great exercise. I continue to pursue that art, and I get to fight and spar a few times a week. So which is good. In terms of medical qigong, it's also something that's not recent. It's something that I've been doing for a long time. And I developed an interest in it. I was very skeptical about it originally, but I had finished up competing in martial arts, and I was left with a few really bad injuries. And I wanted to explore the other side of the martial arts from an energetic perspective, to try to heal myself, because I didn't want to go for surgery, right? I was slated to have like a hip replacement surgery. Because I had a tear in my hip called a labral tear. So I ended up exploring, and I thought, well, you know what, the martial arts tradition resonates with me. Then I started exploring within that tradition, and I saw that qigong and medical qigong is like the core, the epicenter of all of the healing in that world. So then I started trying to learn that, fortunate enough to get some really great teachers along the way. And I was able to heal some of those injuries, right? With using that modality, that actual technique. Where I am sorry, go ahead.
Well, I was going to ask, is it a movement, or is it a meditation style, or how exactly does it work?
Yeah, there's like, you can view it as in sort of two different phases. The first phase is because what you're using to heal yourself is energy, right? But an energy that you can't see, right? And so in order to generate and gather and pool and bring the energy to a point where you can do some healing on yourself or others, you need to do a certain practice. So the practice almost looks like moving meditation. It almost looks like Tai Chi, right? If you've ever seen Tai Chi, right? So those forms, those movements allow you to gather and generate enough energy. Once you have that, then it's learning how to send the energy to the area that needs healing to actually heal yourself, right? So ironically, in the last several years, like past 4 or 5 years of policy medical, when I would visit hospitals, and I've probably been in more hospitals than most people that I know, right? Like hundreds and hundreds of hospitals, right?
But not as a patient.
Yeah, not as well, mostly not as a patient, thank God. But when I would visit hospitals, especially in the U.S., I started seeing in oncology wards and other places qigong on the calendar for patients, right? Because In the East, in places like China, it's part of the hospital system, right? So, you know,
Okay.
if you have cancer, you might go for chemo, and then you have to go for qigong, right? So this is part of it, right? So it's an authentic thing. It's not this hooey stuff out there. So that's really where I'm at with qigong. So I practice it most days. Some of my teachers have been asking me for years to help spread it within the West. So that's something that I'm contemplating now that I have some more time to actually do that. So we'll see where that goes.
Okay. I hope you do take that on. I actually heard from recently from a colleague of mine who just went through cancer and chemo, but I think she had a really similar idea. She'd heard about this, using this as a complementary type of therapy for people that have gone through oncology treatment. And I'm sure it applies in a lot of other disciplines as well. Really fascinating stuff. I love talking about this stuff. Saud, we've gone a little bit over, but I've had a blast talking to you and hearing your perspective on everything that we talked about today. Is there anything else you wanted to mention that viewers might be interested in hearing or learning about from your experiences?
No, not at all. It was great being on. Thanks for having me. It was fun. I can't believe an hour flew by so quickly, right? So it was a lot of fun chatting about this stuff. If anybody wants to reach out to me afterwards to connect with me, I mean, my website will be up probably in the next week or two, and that's probably the main portal for anyone wanted to connect with me. So if you wanted to share that, you're welcome to.
Yep, we'll definitely put a link on that in the description, just so everybody keeps an eye out. Do you know what the domain name is going to be, or?
Yeah, it's Saud Juman, so it's just my name, SAUDJUMAN.io.
Okay, perfect.
Long story why I don't have .com. I had it, but then a company in China just like took it from me. So right now it's at .io.
Okay, fair enough, fair enough. So, Saud, it's been a pleasure again speaking with you. I've certainly learned a lot, and I know that viewers are going to have the same experience listening to this episode. So I really appreciate your time today. Wish you all the best in everything going forward, including spending more time with your family and medical qigong and everything else you want to take part in the next couple of years and months. Again, all the best. Thanks so much for being on the show today.
Thank you.